Thank you for joining me for a microlearning session. Today we're going to be talking about asystole. So some of our learning objectives for today, we're going to look at the key signs and symptoms of asystole, which may seem pretty simple, but we're going to look at what brings us to asystole and what we're going to immediately do with that patient when we recognize that rhythm. We're going to understand the prognosis and potential causes of the lethal arrhythmia and how we approach treatment. So first things first, let's look at the rhythm. Asystole is probably the most easiest one to recognize because it's where every heart rhythm will eventually land, which is a flat line. Sometimes when you're looking at lead 2, I always like to remind people, if you see this, hopefully you're thinking at home, you know what this is. This is not asystole. This means your patient's not on the monitor, right? So if you see the breaks, put your patient on the monitor. Asystole is when you have that flat line all the way across. So what is it? It is the absence of electrical activity. So there is no firing of our myocytes in the heart causing us to have a rhythm. It is life-threatening arrhythmia and typically indicates a lack of blood flow. Always indicates a lack of blood flow. There's no blood flow when a patient has no rhythm. Common causes of asystole, I'm going to take that one back real quick. The only time you can have a lethal arrhythmia and still have blood flow is if your patient's on ECMO, but that is very advanced. Common causes of asystole include severe heart damage. That could be from a massive heart attack in someone's sleep, drug overdose. We know this is a huge problem that we're facing right now with fentanyl, severe electrolyte imbalances. So what do we do with all this? And we're going to go through management a little bit more. This is like our typical cardiac arrest, CPR, epinephrine to bring our patient back to life. So I always like to put this for our nursing students, for you guys. You can't get any worse than dead. So it's all uphill from here. So when you go into a cardiac arrest and you see asystole, you can't make them any more than what they are, which is dead. So always have a positive attitude going into situations like this, because it's a great time, and it might seem interesting to say it like this, but it is a great time to make sure that you're mastering skills and doing a great job, getting your compression depth right, doing everything you can to get that patient back. But we also know that when they have this initial rhythm, you know, the chance of them coming back is normally less than 5%. When their initial rhythm is asystole, because there is no electrical activity going on. So what do we do? First, we have to recognize cardiac arrest. And if you remember from your BLS classes, and I teach these, and I think they're great for everyone to know, is when you walk up to your patient, hey, sir, ma'am, can you hear me? Can you hear me? You check for responsiveness, and then that's when you're looking down, breathing, pulse. So that should last less than 10 seconds, right? And I wrote it right here too for you. Assess quickly. After we do that and we see they're in asystole, if we're in the hospital, we're going to call a code, push the button. If we're in the outside world, say we're at a Walmart, Target, wherever you guys shop, we're going to activate the emergency response system. How do we do that? You call 911. 911. We're going to initiate CPR and get an AED. Caution with the AED, right? We know this is not a movie. We do not shock flat lines. We only shock things that are present. So no shock is going to be given with the AED if the patient is truly in asystole, which is kind of cool, because then you as the provider, if just like I was involved in one at a basketball game, when I put the AED on them and they're analyzed and we get our hands off and it says shock advised, I know that we have some type of heart rhythm, right? Because asystole, there will be no shock given. So that's a kind of cool thing with the AED. We're going to begin high quality CPR, get on that chest, and then make sure we're rotating partners so that we don't have any issues. So medications for asystole, very simple, right? We have one, epinephrine, and there is other meds, and you might read your ACLS book or go take a course and you say, hey, Dr. Moses, there's tons of meds. There is, but epinephrine is really the only med. We have other meds like bicarb, D50, calcium, mag. You might see some of those given, but traditionally epinephrine we're going to give every 3 to 5 minutes during this cardiac arrest and managing the asystole. That's why it's so easy to manage, because there's not much you do. Good compressions and epi. So let's look at some questions now for NCLEX, getting us ready. A client is found unresponsive in his home. Emergency medical services, that's our EMS providers, right? EMS comes in and confirms that the patient is pulseless. The patient's ECG shows a flat line, indicating asystole. I'm even giving you the rhythm. Which of the following actions should the nurse take? So you as a nurse, you recognize asystole. Before you're even looking at these options, you should be telling me, hey, this is what I would do for my patient if I know they're flatline asystole. We already have EMS there, so we don't need to call 911, right? They're already there. Administer epi. Okay. Begin chest compressions immediately. All right. Deliver a synchronized shock. Intubate. Now, throughout the cardiac arrest, they may be intubated. They may get epi. They may need a shock down the road, but what is the first thing you're going to do? You see a flat line. You're going to begin chest compressions. Get on that chest, do some good compressions, and hopefully get our patient back. Let's look at our next one. So a patient comes in, they're in the emergency department following a cardiac arrest. The patient's still unresponsive, and the monitor shows a flat line asystole. CPR is ongoing, so they're doing compressions actively. Which of the following is the most important cue for the nurse to recognize or continue assessing during this emergency situation? So what are you as a nurse, if you're saying you're back there and you're sitting charting and you're giving guidance, what is the biggest cue you're going to look for during this situation? The client's skin color and temperature, the client's heart rate and rhythm, the quality of chest compressions, the quality of ventilatory assistance. Now this one's a little tougher, right? Because these are all things that we're going to assess for. But what is the most important? What's your priority with a patient that's a flat line with CPR ongoing? And if you've taken a BLS course, if you haven't recently, get with me. We can talk kind of getting you up to date with what we're going to be doing as the coach sitting back there. The number one thing that we need to be assessing for is those quality of compressions, right? Is the depth good? Are we getting good chest recoil? Are we getting off the chest good? Are we producing a good end-tidal capnography? So what we're going to be assessing for as the nurse, continuing assessment when CPR is ongoing, is the quality of the compressions. Now say CPR is stopped and we're at 2 minutes and we're checking stuff. Our priority cue to be checking then is going to be the heart rate and rhythm, if they have a heart rate or if they have a rhythm change. But when CPR is going, our continuing assessment is going to be that quality of compressions. So some key takeaways: asystole, you guys know this, medical emergency. We got to recognize the signs: the patient's agonal, not breathing, unresponsive. Mediate CPR, get on that chest, do good high quality compressions, activate the 911, or if you're in the hospital, push the code button. And then post-resuscitation care, once we get them back, we have to make sure, hey, what caused this and how do we fix it? And then we play a vital role. I always like to stress this. Us nurses are very important in this process, both in the community and at the hospital, to get good quality CPR and providing post-code support to our patients. Hey, thank you so much for joining us today for this micro-learning session.